Constipation in kids, symptoms, reasons, and treatments. Disclaimer: the information presented here is not supposed to replace any medical advice from your child's pediatrician. It is just for your general awareness that you may find helpful. What is constipation? Constipation is a common problem in children whose stools, also called poops or bowel movements, are hard, dry, and difficult to come out. What are the normal patterns of bowel movements at different ages? According to Constipation, A Parent's Guide 2016, the form and frequency, or pattern, of stools varies depending on the child's age and the type of feedings received. For instance, 1. Breastfed infants usually have loose to watery stools 3 to 8 times a day for the first several weeks of life. By 1 to 3 months of age, breastfed babies have soft stools from once a day to once every 7 to 10 days. 2. Formula-fed infants often pass pasty stools 1 to 3 times per day. 3. 1-year-old babies eating table food have pasty to formed stools. Stools may be passed between 3 times a day to once every 2 days. 4. Toddlers and older children normally pass stool, which varies in color and consistency, anywhere from 3 times a day to once every 3 days. Infants often cry, fuss, turn red, and sweat when passing normal stools or even gasp. The fussiness may last 5 to 15 minutes. And most likely represents a behavior pattern, not a disease. When examined in the office, these infants appear normal. Signs and symptoms: hard or painful stools, many days gap between bowel movements, bleeding or blood in stool, stomach aches, cramping, and nausea, soiling, brownish wet spots in the underwear, having bowel movements that stop up the toilet, making faces while child passes a stool as if they are in pain, clenching their bottom when having bowel movements. Reasons: 1. Rare medical problem: abnormal position or size of anus, absent nerve cells in the colon, spinal cord disorder, celiac disease, muscle disease, low thyroid function. 2. Non-medical problem: diet, low intake of fiber or liquid, medications. Constipation may be a side effect of some medicines. Sickness: it affects children's routine diet and appetite. How much fiber does your child need? There are different fiber recommendations for children based on energy needs, weights, and age. This table provides examples of high fiber foods. 3. Holding back or withholding stool for different reasons. It hurts to pass a hard stool. Diaper rashes make it worse. Have had a hard time with toilet training. Kids want to continue playing. It is a way for kids, at age 2 to 5, to show they have control over something. Kids do not want to use the public toilets. 4. Any changes in kids' routine. Travel, school change, hot weather, or stressful condition. Signs of resisting the urge to go for toddlers: turn red and red/itching eye, sweat, cry, stiffen their bodies, stand in a corner, lay on the floor, hold onto a table or chair. How to sit on the toilet with the correct posture. Support child's feet with a step stool. Avoid the urge to squeeze with the anal muscles. The ideal sitting position that does not constrict one's rectum and lets the stool pass smoothly is the 35-degree squat position. Pre-treatments: 1. Survey about your kids' health, medication, family members' medical histories, previous surgeries or hospitalizations. 2. Perform a detailed physical exam such as digital rectal exam, X-rays, blood tests, treatments, under the supervision of the child's pediatrician. Cleaning the colon with oral medication or suppositories. Lubricating the colon and softening the stool to make the stool slide along more easily. Asking the child to try to have bowel movements twice a day, Use correct posture while sitting on the toilet. The following tables present the medications commonly used for treatments, the age ranges, and the doses. Tables 1 and 2 indicate general guidelines for the treatment of constipation and soiling. Specific treatment responses and schedules may vary considerably for each child. To clean out the colon area, a child must pass stool. For a constipated child, we can use suppositories or oral medications to help this happen. A second visit may be needed to re-examine the child to be certain that the colon has emptied properly. The Grow with Your Child team hopes you have enjoyed this video and the information presented here. Please subscribe to our channel, give this video a like, and stay tuned for the upcoming videos.